I can speak normally. Hi, good afternoon, everyone. Welcome to the Public Health Sciences Seminar Series. I'm Brad Stoner, I'm the department head, and delighted to welcome you, to have you join us today for this exciting panel discussion among 5 illustrious graduates of the Queen's MPH program, who will be speaking about where can your degree take you, stories from MPH alumni in professional practice. As we begin today's seminar on the eve of the National Day for Truth and Reconciliation, I would like to take a moment to offer a land acknowledgement. We recognize that Queen's University is situated on traditional Anishinaabe and Haudenosaunee territory. To acknowledge this traditional territory is to recognize its longer history, one predating the establishment of the earliest European colonies. It is also to acknowledge this territory's significance for the indigenous peoples who lived and continue to live upon it, people whose practices and spiritualities were tied to the land and continue to develop in relationship to the territory and its other inhabitants today. We are grateful to live as uninvited guests upon these traditional territories. I also encourage everyone to participate in Truth and Reconciliation commemorative activities tomorrow across the university, including the reading of the Truth and Reconciliation report beginning at 7 a.m. via Zoom. Today, we're honored to welcome back 5 incredible MPH alumni who will tell us all about their amazing adventures in the professional world since graduating from our program. We have Lisa Brancaccio, maybe just raise your hand, a knowledge broker at Providence Care Center for Studies on Aging. Sherry Dutton, current PhD student in the Department of Public Health Sciences. Dawn Cole, a foundational standards specialist at KFLNA Public Health. Kaylin Mulvihill, interim manager at Malby Center. And then joining us via Zoom from Ottawa, Shamika Wickramasuriya, Environment Officer with Health Canada. So welcome, everybody. I'm pleased to welcome also Bren Mellis, Senior Program Officer for the MPH program, to serve as moderator today. Take it away, Bren.
Thank you, Brad. Let's just check in with our folks on Zoom. Can people hear what's going on okay? Are we fine, Mike? Just put your comments in the chat section as well. We'll handle them there. So this is really cool to have our alumni back. It's fun to see, and I'm sure you haven't, you're still here, but to see people come back into our space and to welcome them into our new classroom and for others. So thank you so much, folks, for being here. And how this is going to work is I have a series of questions. Hi, Shamika, it's nice to see you face, dude. I've got a microphone here, which I've sanitized well with this wipe here, and we're going to pass it around. And I'm going to ask some questions of our panelists, but there's also going to be an opportunity for you to have questions as well. So if you're, while you're listening, think about what you might want to ask our panelists. And when they speak, they're going to stand probably. And when they stand, they are allowed to take off their masks, which will make it probably easier for us to hear them. So I encourage you guys to do that. You'll still be on camera if you stand sort of roughly in the middle of where you're standing there. Okay, so first question, can you just briefly introduce yourself and what your role is, your job role, but tell us also where your organization fits within the health system, because there's a variety of folks here. Kelly, why don't we start with you? Sure. It's a very different way of speaking. I think you have to turn on the mic. It's got to switch on.
There we go. Okay. So my name is Kaylin Mulvihill, and I work at Malby Center, which is a child and youth autism and mental health agency in Kingston. So we serve the whole KFLNA region, and they're kind of funded separately, so that we do some services that are autism and mental health together. But their mental health is funded through Ministry of Health, and autism funded through Ministry of Children, Community, and Social Services. So we just kind of happen to be the receiver of both funding. So our agency isn't a public health agency. We do more focus on treatment, a little bit of like mental health promotion, but it is mostly on the other side of actually treating children with mental health or autism difficulties. But we do work really closely with the health unit on a lot of projects. So my role, my title right now, subject to change, but it's the interim manager of Roadmap to Wellness, which tells you nothing about what my job actually is. It's a very vague, fluffy mental health type of title. But Roadmap to Wellness is the provincial initiative looking to kind of improve the quality of children's mental health services and adult mental health services across the province. So locally, we have a Roadmap to Wellness task force. It used to be called Moving on Mental Health, which was with our previous government. Now we call it Roadmap to Wellness. Again, a really meaningless change of just going in the same direction. But that task force has stakeholders from public health, school boards, child welfare, hospitals, family health teams. So I chair that committee and work with all of the different stakeholders to kind of work on system improvement in child and youth mental health. And then the other parts of my role are the accreditation lead. So we get accredited every 4 years. I work on like policies and quality improvement stuff to make sure we're kind of have systems in place for quality improvement, that we're following the evidence base. And then I'm also the privacy officer. So I make sure that we're following our privacy protocols, do incident reports for privacy breaches, make sure we're getting consent from clients. That piece can be tricky with mental health. There's obviously a lot of vulnerability in our files. And then we're also working with children and their parents. So custody issues and stuff can come up a lot in that sense. And then the one other piece is I'm also the client advocate. So any kind of client complaints or issues that get escalated come to me to work with. So
Wow.
basic overview.
So why don't you pass off to one of your colleagues?
Hi, everyone. So my name is Sherry, and I'm a third-year PhD student in the Department of Public Health Sciences in the general stream. So my research is focuses on the contextual influences around intentional teen pregnancy and also looks at the role of public health regarding that. So I'm a qualitative researcher, so not using numbers, but using interviews and other pieces of data. And I would say that research in public health is more about looking at understanding the health of populations. And as a qualitative researcher, my role is really more at looking in depth rather than the breadth of those experiences and perspectives, and looking a little bit more at the nuances around that.
Sure.
Hi, everyone. Whoa. So I made a few notes on my phone, so forgive me for looking down. My name is Lisa Brancaccio. I'm a knowledge broker at the Center for Studies in Aging and Health at Providence Care here in Kingston. So our center is primarily a knowledge translation and exchange hub for resources and expertise to promote the health and well-being of older adults. So we do this through research, education, knowledge transfer, capacity building, and creating collaborative networks. So I manage a few of our ongoing projects, and my main one being the Ontario Age-Friendly Communities Outreach Program. So in my role as a knowledge broker, my activities kind of differ day to day, but I was thinking about this before, and they can kind of be categorized into a few different areas. So the first one being knowledge management. So identifying and collecting relevant information for our stakeholders. The second one being translation, knowledge translation. So taking, complex research evidence. Sorry guys, juggling a lot here. Taking complex research evidence and putting it into accessible and manageable language for our different stakeholders, and putting that into relevant policy and local context for stakeholders. The other one I was thinking about is relationship building and developing and facilitating collaborative networks. So there's a lot of people that have questions and a lot of people that have answers. And I try to bridge that gap between the two and connect them. So, and then I do things like capacity building. So providing ongoing mentorship and customized guidance to our stakeholders. And then how this fits into public health. I'd say it's just a way of advancing that evidence-informed decision-making in public health and improving stakeholders' capacity to do so to improve the health of communities. Okay, thanks.
Hello, everyone. So my name is Dawn Cole. I'm a registered nurse and a foundational standards specialist with MPH Alumni Public Health. And that is a local public health agency that is here in Kingston, but we actually serve the greater KFLA area, so Kingston, Frontenac, Lennox, and Addington, which is a region that goes up to about, I think, 3 hours-ish, just under 3 hours north of Kingston. So quite a large geographic area that we represent. My job title, I think, is sort of similar to Taylor's, so that it doesn't really mean anything. I'm a foundational standards specialist. I get a lot of invites for like concrete, and I get different things on LinkedIn about like, do you want to build houses? I'm not that kind of foundation person. Essentially what my job is to build capacity within my organization to help all staff use the foundational standards in their public health work. So if you're familiar with the Ontario Public Health Standards, which is sort of that large document that comes from our government in Ontario and sort of defines what local public health agencies are funded to do in their different regions. And we're one of 34, I think, local public health agencies now. So within that document, there's a section called the foundational standards. The foundational standards are things like knowledge exchange, knowledge translation, using effective evidence-based practice. There's a lot of continuous quality improvement work as well. And so in my role, I assist all of the people that work in my agency to use those concepts within their work. So that can look really different depending on who I'm working with. If I'm working with someone, maybe a manager who is really well-versed in, for example, research methods and things like that, then I might just be more of a consultant for them. Whereas if I'm working more with a team that doesn't have anyone with those skill sets, then I might be the doer that's actually helping them with the program evaluation or with quality improvement. And recently my role has actually just been moved to our chief nursing office. So that's a new thing for me. I'm not totally sure what that's going to mean, but that's a new change for my job that just happened in the last week.
So even though she's not here in person, she's here live via Zoom. Shamika is next. So why don't you talk to us, Shamika?
Hi, can you hear me? Okay, so yeah, my name is Shamika. I'm an environment officer at Health Canada. I'm relatively new at my role, and I assist my team in prioritizing chemicals for risk assessment. And we also tried to look into NAMs, which stands for New Approach Methodologies, which helps to do these prioritization exercises without using animal testing. And I guess where my role fits into the system is at the federal level, and we're looking to improve the health of all Canadians. Thank you.
Good to see you. Thank you for teleporting in from Ottawa. So what's interesting to me hearing all those introductions is the different places that people have gone, different settings, different parts of the health system. And also really impressive given that it's really not that long ago that they finished their MPH at Queen's, and already they're in really interesting roles with influence both in their organizations or in the health system in general. So think back a little bit to when you finished your MPH and walk us through, just so students can understand better, what were the key steps that brought you from like graduation to the actual role that you're in right now? Dawn, why don't you start?
Okay, so for me, I guess my experience is a little bit different. So I was working with KFLA when I was doing my program here, but as a nurse. So after I graduated, I went back to the role as a public health nurse. After that, there was actually an opportunity that came up. Someone was going on maternity leave, and so I took a contract working as a research officer in our agency. So it was sort of it was kind of a lateral move, but allowed me to get more involved in things like hands-on program evaluation and research and epidemiological research especially. And I think being able to show that skill set over that year and also get more experience working with different people in the agency and sort of getting that opportunity to be seen as not just a nurse, but someone that has additional expertise as well, helped me with getting into other projects. And then after about a year of doing that, this job was posted and I applied and had lots of things to talk about in my interview because I had spent the last year doing a whole bunch of that work that they were asking me about. So that's how it worked for me.
Shamika, why don't you go while we're passing the mic here?
Sure. So I guess just graduated recently. And what I tried to do was after like my practicum, I wanted to continue being on my team. So I signed up as a part-time contractor. And while I was finishing up my MPH, I was working part-time with my team. And then I was kind of upfront about my enthusiasm for the job. And I asked my manager, is there a way that I could stay on in any capacity? And from there, she offered me a job, which was amazing. And I guess to make sure that I had time to work while finishing my degree, I overloaded my second semester. So that way my other semester would be a bit lighter. So maybe that's something to think about.
So yeah, to clarify, so Shamika got a job with the same organization who hosted her for her practicum.
Have a mic up there.
Yeah.
Hard to hear you back there.
All right, who's got the mic? Yeah.
So listening to Shamika, my experience was actually quite similar. So thinking about key steps that I think could be practical advice for you guys to take away. Maintain your networks that you make during your whole degree, especially at your practicum. So continue to build and strengthen those relationships because you never know what can happen. Yeah, that's what I'm going to say there. Thank you. Well, I also was hired where I did my practicum like Shamika, so just continuing that and making sure I'm networking and maintaining those.
Okay, I didn't say where my practicum was. I did stay to work I did my practicum at KFLNA Public Health and stayed there part-time for a little bit in my last semester of school, but then I applied to my job at Maltby Center, so I've been there since I graduated. But I started in a contract role as a data analyst, and I just moved into my new role in January. So I did the data analyst role for about 5 years. It started as a contract and eventually turned into part-time. So my recommendation would be to be open to contracts for sure. That's how a lot of jobs start out. And to be open to things. I mean, if you know you absolutely want to work in public health, then that is fine. But a lot of transferable skills. So like I said, my agency isn't necessarily a public health agency, but I definitely use a lot of the skills I learned in my MPH in my role. And similar to Shamika and Lisa, I had supervised an MPH student last summer, and then we hired her in the role that I left. But she's leaving soon, and that role will soon be open. So if anybody's looking, I'm happy to chat.
So very similar to others, I actually used my practicum to roll into my PhD. So my practicum was under Dr. Colleen Davison, and she's now my supervisor for my PhD. So when I started my MPH, I wasn't thinking that I was going to do a PhD, but then I kind of fell in love with qualitative research. So I really kind of tried to focus my practicum around a qualitative research practicum. And then from there, kind of maintain those networks. And I also tried to sort of focus a little bit on building that independent research piece. So I took the lead on co-authoring a methodological paper. I also did some presentations as well and tried to build those areas too.
Thank you. That was fascinating. So a few different paths, but also some commonalities between all of you to how you've gotten to where you are. Let's dive back a little bit back into the role that you're in right now. And I know you've kind of explained your tasks, but can you talk about what you like about your role, what you find challenging or unexpected? Just give us a little bit more of the flavor, I guess, of what you do. Lisa, can we start with you?
So certainly what I like the best about my role is I'm always learning and every day is different. So as I mentioned before, each day can look different and I'm using a different set of skills. So, you know, in the morning I could be collecting or critically analyzing some research papers or something like that. And then I can switch into like a mediator or team building role and using communication skills. So I really like the variety there. Another thing I really enjoy about my job is synthesizing different research evidence and using my critical thinking skills. So taking evidence and applying it to different contexts of our stakeholders. So maybe that's local context, maybe it's regional or provincial. And really seeing how that would fit into their situation and offering that to them in some sort of resource. I really, really enjoy that aspect of my job.
So I think I'll just sort of add to what's been said, because I feel like we're just kind of very repetitive. But for me, I think one of the things that I really like about my job is there's a lot of autonomy. So being sort of the one person or one of a few people who has that role within the agency, there's a lot of autonomy for me to sort of determine what my role is going to be and how I'm going to support. And so that I really like because I'm able to sort of find a niche, figure out what my skill sets are, and then also help identify some other people in the agency that maybe could be brought into. So I really like the collaboration aspect that my job allows me to do as well, because it's not at the end of the day about me sort of doing all for everyone. I'm there as a resource, just one of many resources that the agency has, and sort of helping work with all of the team and the entire team to make sure that we're all sort of collaborating together to reach the goal. I really like doing that as part of my job. The other thing that I would say is the ability to, because I am working in a local public health agency, I like being able to be a little bit closer, I guess, to the ground. And sort of seeing the clients and the impact that we're having as an agency on the community and the health of the population. So I enjoy that aspect too, and my role allows me to be involved in all of the work across the agency. So I like that. I don't sort of get stuck into one topic. It's every work, all of the work that we do as an agency.
So, Shamika, why don't you talk to us about what you enjoy about your position, but also another part of the question was what's challenging about so I'm going to encourage our last folks to add to that too. So what do you really enjoy about it and what do you find challenging about it?
So what I really enjoy about my job is the people that I get to work with, collaborating with them to work on just these documents that we submit to international organizations are really, it's really nice to work with them. I also enjoy kind of looking at data and trying to find trends. That's something I enjoy doing. As for challenging things, just having recently graduated, I guess I wasn't prepared for the amount of meetings that come up in the workplace. So those take up a lot of time. So that's somewhat challenging in a sense, or just surprising, really. So that's what I have to say.
Okay,
What I really like about my role, I echo a lot of the things that Lisa and Don said. I have a lot of autonomy. Being the only person that has a role kind of similar to mine, I can bring a lot of ideas forward, and it's often a go ahead. So I can, start a lot of new initiatives or kind of insert myself into projects just because I'm interested in them. And also similar to what Don said, I really like that being like close to the ground. I can, even though I don't work directly with clients in my role, I can see the impact the projects I'm working on have on clients. You're close enough to them. And I really like kids, so working in the Child and Youth Mental Health Agency is also rewarding. Haven't seen any of them in 2 years, but before, when I was in the office, you get to see the clients walking through the hallway, and a lot of our autism clients come to the office every day for more intensive therapy. They would do things like trick or treat to your office at Halloween, and it's just like a fun environment to be in when kids are around. A challenging part of my role in my new position would be the privacy piece. I was involved a little bit in privacy before, but the role of privacy officer sat with our executive director, who was obviously a very busy person, and it would end up being kind of off the side of a desk versus somebody focusing on it. And an agency of our size, we're like 140-ish employees, should really have a whole kind of privacy program. So kind of being handed a role without a lot of, no one had looked at it too closely before, but it's super important. And as I spoke to previously with children and youth and parents especially. So kind of getting the privacy program off the ground, getting people to think about it a little bit more and change some of their practices has been challenging. I had to kind of seek out my own training and seek out my own resources and read HIPAA a lot more than I ever cared to before. But it's been challenging, but also kind of fun. Because like I said, I can kind of invent things like privacy newsletters or things like that and try and find ways to make them maybe more fun than a privacy newsletter sounds.
So I'm going to kind of echo what a lot of people said. So a lot of the diversity is what I like for my day. So I get to do all kinds of things from focusing on my own research to being involved in other research, co-mentorship activities, co-authoring on papers. I did an evaluation project for an arts-based therapy program with newcomer families. So I get to do a lot of different work. And with qualitative, I get to bring in a lot of different pieces. So I like to use art in my research and social theory and all different kinds of methods to do things more community-based. So I get to bring in a lot of different elements. I guess the most challenging when you move from a professional program to a more research-based program is, especially after your first year, things kind of open up. So you really have a lot more autonomy, but it also means that you kind of have to figure out what you want to build into your years here, what directions you want to take, what skills you want to build. It's really kind of wide open for you to determine that. And then also as a researcher, you're always thinking of, deadlines for grants and scholarships and deadlines for conferences and what your next sort of writing piece is going to be, and always kind of strategizing and thinking ahead. So that's something that takes a little bit to kind of get into the groove of that.
Just stay up there, Sherry. Just before I ask this question, I want to remind you that we're going to invite the audience, including people on Zoom, to ask questions of your own. So if you've got questions, think of them now because they'll be coming up next, and put them in the chat, and Paula's going to moderate that for us. So just if you think back to when you did your MPH, can you think, what are the top skills and knowledge that you learned actually in your MPH that you now use in your research role as a PhD student or in the roles that you're going to talk about? I know you've learned, of course, when we come into professional work or into doing a PhD, of course, you were learning so much in that context, but what are you pulling from your degree itself?
Yeah, so I pulled a lot from my degree, from my practicum, of course, because I did a lot of semi-structured interviewing and community-based work and then writing and those kinds of pieces, but also from my time in my courses. So program planning and evaluation, when we look at different knowledge translation pieces, conceptual models, I use those for my research. understanding the history of public health systems and the foundations of public health. I use that now when I kind of look a little bit more critically at the role of public health in regards to teen pregnancy. And even EPI, I think, played a big role. Even though I'm a qualitative researcher, I think the analytical aspect and the practicality of quantitative research really kind of helped me to focus on that. So for my PhD, I kind of went outside of the department for a lot of my coursework, wanting to gain more around different theories and methodologies and things like that. But that can often get like very sort of theoretical. And in each one of my courses, everyone kept saying, you're very practical. And I think I got that from the quantitative, where it's like, well, okay, but boots to the ground, how does that work kind of thing? And so, especially for like an early career researcher, I think that's really important to kind of always think about the practicality of that. So I gained a lot from my courses here. Yeah, I think that's
Great, I just want to pass off to somebody.
So I have some kind of different skills I'm using in the role I was in when I first left my MPH and now. One of the big ones I was using in my former role was survey development. I actually had just finished your course, Duncan, and written the exam, and in my interview they asked me what steps I would take to develop a survey, and I had a perfectly memorized list of 10 in order. So maybe I should thank Duncan for my job. So I use that skill a lot. We do a lot of surveying of staff and clients. And then the knowledge translation piece I use a lot in both roles. So we do a lot of like client feedback data and communicating that back to different audiences. So to staff, the staff at my workplace is largely from like a social work or child and youth work background. And there's a culture of like data hate. So having these people look at data in different ways and ways we can engage them. If you send like an Excel document, a lot of people won't even open it because Excel might be kind of intimidating. So using things like infographics to communicate. And then also that awareness of the social determinants of health and tying that into the clients we serve. So again, something like a client feedback survey, we want to communicate it to staff, to stakeholders, and also back to our clients. We could say, hey, you told us that you didn't like this about our programs. This is what we're doing to change that. But that needs to be communicated in a different way to them too. And I've also got to work with our family and youth advisory committees a lot and kind of build more client engagement in that way. And use a lot of those kind of knowledge translation skills working with those groups too.
Shamika, do you want to chime in?
Shamika, are you there? Would you like to chime in on this, on what skills that you're using?
Sure, my internet's a bit spotty right now, so I hope everything is smooth. As for the specific skills, I definitely benefited from the EPI course. It really helps to kind of analyze the paper, and it's like, is this good quality research or not? Also, vulnerable populations are really emphasized throughout the program, and I've
We lost you.
We lost you there, Shamika. Maybe we'll come back to you and we'll move on when your internet is stabilized. Lisa, do you want to go?
So first I'm gonna circle back. I missed my challenge, but then I'm gonna bring it all back. So I've been talking about identifying different sources of research and translating that. And I guess I should say that that's not just being pulled randomly. This is in response to stakeholder needs. So continually assessing the needs of our stakeholders and seeing what they need and filling those gaps that way. So in that respect, what's equally a challenge and super enjoyable about my job is that those topics can span a whole bunch of areas. So most recently, looking at program evaluation. So the program planning, implementation, and evaluation, that course has super come into play recently. especially program logic models, which learning them during the program, not so fun. Using them now is amazing. So I highly recommend learning all you can from that course. It's really, really helpful, and that's certainly what I'm using currently. And then most just generally, knowing about social determinants of health and those foundations of public health certainly comes into play with my work in age-friendly communities. So thanks.
Thanks, Lisa. Yes, so first year students, you'll be taking that applied research for program planning and evaluation course next term. Shamika, it looks like you're back. Do you want to complete your thought?
I don't know where I stopped. I guess I'll just kind of build off that. The Foundations of Public Health course was also very useful with understanding vulnerable populations and knowledge translation. And I also really liked Bren's course with the professional development. I think that was super helpful. Just interacting in the workplace as well. So yeah, that's everything.
Thank you. Dawn?
Okay, I will go back and talk about my challenge too. So I think one of the challenges in my current role that's probably it's stayed with me for the longest I've had it is the fact that my role might give me a lot of autonomy, but it does not give me authority. I don't have authority in my agency to determine that what I think should be done is what gets done. So I have to be very persuasive. And that in itself is a skill that I am gaining more and more every day. But I think that's a big thing that I sort of didn't expect. It was like, well, I should know, people should just listen to me. That's not what happens. So yeah, that's probably the biggest challenge, but it is still really good work. I do enjoy it a lot. In terms of current skills that I use now, so I'm going to echo everyone, program evaluation, like 100%. All the time, every day. Surveys, also knowledge exchange, especially with feeding those results back. So we've done an evaluation or we've done a survey. Now, what did it tell us? And then how do we tell our Board of Health that that's what it said? So sort of helping, working with staff to sort of build some of those knowledge exchange tools as well. Epidemiology and stats I use all of the time because I'm often one of the only people or one of a small group of people who actually understand it. And then my role is to help everyone else understand that that's why we have to make the change that I'm recommending be made. So those are also skills that I use all the time. One of my electives that I chose, which I highly recommend if anyone is interested in sort of similar work, is qualitative research methods. That was a really, really good decision. Because I learned a lot in that course that I use all the time. A lot of my work is doing mixed methods research. And so I found with having that qualitative elective, in addition to the evidence stats that I already got from the program, it really helped me to sort of round out and get all the skills that I needed.
Interesting. That was fascinating, actually, listening to you guys reflect on how your coursework has informed your professional practice. Paula, do we have any questions that we can talk about on the Zoom chat?
Nothing yet.
Nothing yet? Okay.
I invite people to
Anna,
type in.
I see your hand up. What's your question?
I have two questions. The first one is for Shamika. So I'm guessing you can hear me. You mentioned overloading your semester or something like that when you graduated or when you continued your practicum. What did you mean by that? Like, did you take extra courses after December?
So the question is about Shamika's comment about quote unquote overloading her second semester in order to lighten up her final semester a bit more. Shamika, can you clarify what you meant by that?
Yeah, I just took an extra course. So instead of taking 4, I took 5 courses for the second semester. And then for the kind of final semester after the practicum, instead of taking 3, then that allowed me to take 2. So I had time to, it was still hectic to finish school and work part-time, but it's a lot better to do 2 than 3 courses. So that's what I meant.
And then your second question?
I just was wondering, more like, are your jobs 9 to 5? And what's the work-life balance? Any comments on that?
So this is a great question about work-life balance and how the timing of people's jobs works. Are they 9 to 5, Monday to Friday kinds of things, or are they different?
So mine is Monday to Friday, 9 to 5, except when you're working in COVID. And then it's a little bit different, but if we pretend that we're not in a pandemic, then it's Monday to Friday, like 9 to 5 for me.
Yep, nothing too out of the ordinary, 8:30 to 4, depending on meeting times and maybe time zone differences. Maybe it's a little earlier or a little later, but pretty standard there.
Yeah, mine is also pretty standard, 8:30 to 4:30. Our agency offers different hours for like to be available for clients. So the odd time I might, if I'm involved in a more client-facing initiative later. And then in my management role, we're like expected to work some overtime and just we don't like bank it, they get extra holidays instead. So I do a lot of evening emails and things. So my normal hours are 8:30 to 4:30.
I would say my day kind of varies. So of course, when I'm doing my coursework, that's more during the day. But I also have a 3-year-old, well, almost 3-year-old son. So it depends with my childcare. So sometimes I work early mornings, sometimes I work late nights, sometimes I work during the day. It's nice that I'm able to have that flexibility and that understanding of my supervisor.
What about you, Shamika? What's your time like?
It's typically 9 to 5. Sometimes when deadlines come up, I think most people just work extra. But as for, I think outside of COVID, I'm pretty sure in person, I've never been to work in person, but it would be 9 to 5. But sometimes we have international meetings. So if that's in European time or Paris, like in Paris, sometimes I've had meetings start at 4 a.m. So get your coffee out. And yeah, that's not always the case though.
So, other questions? Can I see your hand up?
Yeah, I just wondered, I'm trying to, what's the one thing you wish you'd know now, that you wish you'd known when you started your MPH? The one thing you wish somebody had told you during your first month?
So Duncan's question, what's the one thing that you wish somebody had told you when you first started your MPH that you now know?
Not meant to be hard question.
I had a lot of anxiety about finding a job afterwards, and I began to convince myself that only people like Dawn who already had a job would have a job.
And I said, that's not true.
Yeah, that's not true though. I think everybody in our class had a job within like maybe 3 months of graduating. And they're all have like lots of movement and stuff, but everybody's in jobs that they, for the most part that I know of, that they like doing. But a lot of people were kind of pursuing medical school or things after, and I knew I didn't want to do that path. So I know I would get anxious a lot that if I wasn't going to go on to med school or wasn't already like in a professional job, that I was unhireable. But that is not the case, and I maybe you don't need to know that now because you're in a pandemic and public health should be able to find a job. But yeah, I would like to tell my past self that it will be fine. There's jobs out there. You have a lot of transferable skills.
That's a great message. Other people, thoughts on that?
I just thought of one thing that I wish I had known, and I don't know maybe if they do know this now, but there's a lot of like free or almost free online courses and things like that you can take to add to your sort of skill base. Some of them I know, or at least it was an option where you could actually get them as an elective, like if you found a of course, that was another school that you really enjoyed. I don't know what the process is now, but I think it was Kaylin actually, where someone had taken this online GIS course and it was like how to make maps. Emma, and it was amazing. I wish I had known that there was things like that out there. That just a quick Google search, you know, there are some free things out there through Coursera or what it is. That if you're looking for, especially if you're looking for a very specific thing that's not offered by the university, there's lots of opportunities out there to get it for yourself.
We've got a question coming in from Zoom.
Okay, so I'll take my mask off so you can hear me. One question is, a lot of you have continued on from practicum to career, so that transition of coming from your practicum to the same host organization. Given your experience, what advice would you have with regards to the actual practicum application process? So just a quick sentence of what your process was. Tip, perhaps.
So tip on applying for practicums, is that the question?
Just what you remember, just maybe one or two people to, we have other questions as well. And we'll be covering that shortly.
Yeah, the application itself, it's just like applying to any job. So make sure you would tailor your resume and cover letter specific to the skills and subject area of that. Apply to organizations that maybe you didn't see yourself in. You know, a lot of opportunities in public health. There's a whole spectrum of opportunity. And some of you might have a broad idea or broad vision of what you want to do. Some of you might know specifically what your career path you want that to be. You know, you can seek out those roles by yourself, not just what's posted. I believe you can still do that. So do that and ask questions. If you interview for a position and you don't get it, follow up, ask them why, or if you could have a chat about what you could have done differently, and just try to learn from everybody along the way.
I would add for practicum placement, assuming you can go anywhere, right, not just posted positions, that if you are willing to do an unpaid practicum, especially, to offer yourself to organizations rather than only apply to like posted student positions. Because I know my organization had never taken a student before until I came to one of these talks, and then a student approached me afterwards asking about doing a practicum, and we've had 3 now, and they've been super helpful. So the organization might not always be in the position to have like exact funding to pay a student, but if it's an organization that is an area you're interested in, reach out to them and see if you might be helpful.
And Paula's going to be doing her briefing on the practicum shortly next week, I guess. So first year students, you'll learn more about that process. Just we're short on time here, but question for Sherry. And for those also others of you that are interested in a more research-oriented track, were you able to apply right to the PhD program after your MPH, despite not having a typical research-based MSc?
Yeah, so pretty well, I would say. So I was in the accelerated stream. So when I graduated, and I was also pregnant when I graduated. So I graduated and had my son, and then kind of had to wait for the general stream to open up. I was one of the first cohorts of that stream. So I guess I would have graduated in the fall of 2018 and then started my PhD in 2019. So kind of had a little bit of time on mat leave and going through the application process for that. But yeah, pretty much right away.
For those of you interested in that kind of track, maybe I'm sure Sherry would be interested in having a more detailed conversation, I guess, about how that could look.
All right, we are at 1:20, and I want to thank our panelists including you, Shamika, for being with us. Really interesting to hear about your varied stories, interesting to hear about what skills that you're applying, and so impressive to know that you are out there making a change for the good in the public health system and beyond. So thank you so much for being here. We appreciate it. All the best.